Welcome to Behind the Investigation on Atlanta News First. I'm investigative reporter Andy Parati, and joining me now is Sierra Cummings, an investigative reporter on the team. How you doing, Sierra?
I'm doing good. Happy to be here. Important story to tell.
Absolutely. Your investigation involves responding to emergencies when seconds count. Set us up. Who and what is the story about?
This story focuses on the city of Brookhaven. There's been this question going around for a few years now in that city. If you call an ambulance, if you call 911, will an ambulance show up in time, or will it show up at all? So much so, things have kind of hit ahead over the last couple of months that the city, the mayor, city council, other residents have been calling for their own ambulance zone. They want the rights to operate their own ambulances within city limits, because right now they're at the mercy of DeKalb County. The county chooses who is the ambulance provider for all of its cities. So that brings us to this story. We wanted to profile situations where it is taken a while for an ambulance to show up. And we want to see, is this an outlier or is this a part of a bigger trend? Here's the story of Steve Christian.
You're dying?
Yes.
That's all just been okay. Go ahead and start AMR to Blackburn Park. Just relax, stay in the car. Is your chest hurting? Hang tight, hang in there, okay? Got help coming.
A Brookhaven officer responds to a shots fired call March 2023. This is police redacted body camera footage.
Have you been shot? Have you been shot?
Within moments on scene, the officer confirmed the reported shooter and the victim were the same person.
Did you shoot yourself?
Yeah.
You shot yourself?
Self-inflicted and intentional. Steve Christian was dealing with cognitive memory loss. According to the letter he left behind, the diagnosis made the 77-year-old veteran want to die by suicide. Despite that letter and what happened before, interactions on this footage seemingly indicate Steve now wants to live after all.
I'm sorry.
It's okay, it's okay. We're here to help you, okay?
Lift up. Lift up.
In case files obtained by Atlanta News First Investigates, crews detailed Steve begging for help, recalling that the veteran kept saying he, quote, messed up.
Help me up.
Although Brookhaven police blurred and silenced graphic portions of this footage, you can hear many of Steve's cries over
I'm sorry.
and over.
I'm sorry.
At this point, 15 minutes have passed from when the first officer arrived and called for an ambulance.
I'm sorry.
There are more officers now, but still no ambulance.
I think we gotta move them.
Now, 18 minutes in,
Let's go ahead and get an ETA. We're gonna need to step this up.
the rain picks up as police say time runs out. Still, no ambulance.
Oh, man.
20 minutes on scene. Still, no ambulance. 22 minutes in, the cab fire arrives as backup. The fire truck is not capable of emergency transport, so crews still need an actual ambulance. 26 minutes from when the first officer came on scene and called for help, ambulance help finally arrives. Steve Christian died at the hospital.
We're here to help you, man.
Watching this
It's not any easier.
is difficult for Brookhaven Police Chief Brandon Gurley.
Asking for help over and over and over again, and the police officers on scene are rendering aid and providing the help as best they can. But what this individual, the help this individual was in need of, was an operating room, and that help didn't arrive in time.
That 26-minute wait for an ambulance is more than double the county EMS standard of 12 minutes for life-threatening calls, a standard American Medical Response, or AMR, agreed to when the company signed this DeKalb County contract. Has something gotten better?
No. It's a weekly, almost daily occurrence that we're going to be waiting. Our officers are going to be on scene waiting.
Atlanta News First Investigates analyzed City of Brookhaven records from the last 4 years. Data shows 90% of AMR's response time for life-threatening calls increased from 16 minutes in 2020 to 21 minutes so far this year. Records show in some cases, police decided to drive the victim to the hospital themselves in their own police car because of the delayed ambulance. Police cars not at all equipped for that.
We don't have stretchers, we don't have IVs, we don't have ways to administer medications en route to hospitals, we don't have an area big enough in our car.
We've gotten more impatient.
Mayor John Park blames growing delays on DeKalb County failing to hold AMR accountable.
Lack of enforcement, and then the penalties are so small that it's actually cheaper for them to just pay the penalty than it is to actually provide the services.
DeKalb County records reveal just how some of it works. Each quarter, AMR is expected to have 12-minute response times for 90% of its urgent calls. But if AMR fails to meet the 90% threshold, the company faces a $1,000 fine for each percent below. Example, if in quarter one only 86% of calls met the contract standard, that means it's 4% below the 90% threshold. Then 4 times $1,000 equals $4,000 in fines for quarter one.
I want to improve response time.
As far back as 2020, AMR faced $2 million in DeKalb County fines, but only paid $600,000 of it that year. The unpaid money would not be Mayor Park's concern if it weren't for the performance. AMR would not interview with us, but said it's, quote, fully committed to DeKalb and open to working with Brookhaven on innovative solutions.
They say they're doing it, but it's really just works more than anything.
It's why the city wants state intervention. Brookhaven wants to be in charge of their own ambulances, a move that would require the Georgia Department of Public Health to change zoning and consider other eligibility requirements. Even if the state approved it, City Council must consider funding resources to pay for a new ambulance company, potentially increasing taxes on Brookhaven residents. There's a cost burden on the taxpayer.
There's a cost burden if we don't do it.
So they've submitted the paperwork and pleas to sever ties with DeKalb County's ambulance service in hopes that Brookhaven is done waiting.
You're dying? Hang tight. Hang in there, okay? Got help coming.
He said anything wrong when they come back?
He just said, help, I'm dying.
That's all he said.
Sarah, this really pulls at your heartstrings and makes you so frustrated and very upset. We didn't hear from Steve's family. Were you able to contact them and hear what they're saying about this?
Yeah, it's really a heartbreaking story in more ways than one. And unfortunately, Steve had no surviving family members. He wasn't a father, so he didn't have children. His ex-wife was his closest family member. She said that they were best friends up until his death. And it's, very rare that you're friends with your ex-wife or your ex-husband. So they had a very special connection. He left her a suicide letter and 2 other friends. I talked to all of them. They described him as an active outdoorsman who just used to build homes across metro Atlanta. And of course they miss him and they love him. And, just keep them in your thoughts at this time. It was really difficult, but they didn't want to be a part of the story. They just chose to talk to me behind the scenes as I was gathering the information.
Oftentimes when we hear about stories, the reason why we start investigating is because a family or a friend reaches out to us. So how did you hear about this story? Was it family? Was it someone else?
It was through incident reports. As we were saying, this has been a cry that the city wants to run their own ambulances for all of Brookhaven. So we requested incident reports and 911 audio related to ambulance delays within the city's jurisdiction. And this was one of those cases. We were able to read through the police narrative, then request the 911 call, then request the body camera footage, and kind of put together a narrative based on there. But it really started from just being nosy, digging around and wanting to see documents that proved some of the points that the city was making.
AMR is one of the largest, if not the largest ambulance company in the country. Are you hearing reports about other municipalities, other counties experiencing delays in response times? I know that we've previously done investigations about Grady ambulance, Grady Hospital having delays, but I'm just curious about AMR.
Yeah, it's worth it. This doesn't happen in a vacuum or in a silo. And just like we saw across multiple industries after the pandemic, a lot of industries are facing staffing shortages, money shortages, funding issues. And so that affects the ability to staff certain ambulances in different cities across DeKalb County. So just anecdotally here, though, we have heard from other cities in DeKalb County, but also in Fulton County that are dealing with some of these delays that even go beyond ambulances. Some delays directly connect connect it to 911 call centers. We've done those stories, and as you hinted at, Grady response times as well. So it is a bigger deal, but particularly when you look at the data for Brookhaven, it does seem jarring compared to other cities in DeKalb County, compared to other cities across the metro.
I know AMR and other counties are experiencing, or they're experimenting with diverting non-emergency phone calls to call centers where there are trained nurses on the other end of the line that are trying to help out with the staffing shortage that you're talking about. Do we know whether DeKalb County is doing this? Is that something that they're looking at? Because AMR's response was like, we're looking for innovative ways to try to deal with this. I think that's what they told you, right?
Yeah, it seems like they might have been hinting at something like that, but they wouldn't get into specifics. As you can tell, they were not a part of this story. They chose not to interview with us. We're hoping that maybe they will. The offer still stands, but at this point, it's kind of vague. Innovative solutions. Yeah. We do know that certain cities have worked with the company to create immediate solutions, like the city of Brookhaven. This has been going on for a year or two, so they decided, hey, let's create our own ambulance bay in the city of Brookhaven where AMR can staff actual ambulances right in the heart of Brookhaven. And so some other cities are doing that. People want to put funding behind AMR, give them more incentive or more resources to staff their particular city. But at this point, we're waiting to see those specific ideas. We just know that they're in a place right now where they're seeking more innovative solutions.
Now, this is a really important story. I mean, literally anyone that picks up the phone and calls 911, they expect an ambulance to arrive in a timely fashion, and unfortunately that's just not the case in Brookhaven. Sierra Cummings, thank you so much for this important investigation. You can watch more of Sierra's investigations on AtlantaNewsFirst.com and anywhere where you get your podcast.